Ready? Good afternoon. Thank you for coming out. Welcome to our unveiling of Phase 1 of Newark's reopening and recovery plan. Before I begin, I'd like to just thank Governor Murphy for his leadership during these perilous times. And I know it's difficult to make decisions for the entire state of New Jersey, given our conditions are invariably different from county to county. According to Johns Hopkins University, New Jersey was just listed as one of the 3 states with the fastest falling coronavirus cases, along with Missouri and Idaho. And that is considerably extraordinary and significant, as New Jersey is one of the hardest hit states, second in the country only to New York. Now the Navajo Nation is even higher than New York City. It's also significant because as 50 states begin opening up, maybe 17 or 18 of them have proof of a reduction in cases. New Jersey, by the grace of God, is one of those states. And this is primarily due to the governor's, I believe, early action in our state having one of the stricter and longest enduring stay-at-home orders. And as mayor of the largest city in our state, with one of the highest affected populations, I am unveiling Phase 1 of our plan today and believe we will continue this trend to flatten our curve here in Newark. I just want to thank all of the mayors across the state and our country who are all working to reopen their communities safely, who are in some instances doing it in duress, with, opposite of what the governor's orders are in their states. Thank you to all the City of Newark employees, the partners, and volunteers for assisting us in this fight. And a special thank you to our police director, public safety director, who recently lost his mother, who they're having services for today as we speak, and has continued to protect our community through this. And finally, thank you to the co-chairs of this task force, the Chief of Staff, Mary Baraka Jr., and Aisha Glover of the Newark Alliance, and all of the members of the Newark Recovery Strike Force, who I'll mention later on. As of today, Newark has 6,930 positive cases and 549 deaths. There's a steady decline in the number of new cases and deaths since the week of April 5th through April 11th, which was our highest week in the city since the start of the pandemic. If you can see the chart, we were as high as 71% positive cases. And that's based on the number of people tested. 71% of those people came back positive. And as you can see now, as we move forward, we have gotten down to 18%. And we want to go and be consistently lower than that. As we continue to analyze data and look to reopen, we will lean on recommendations from the following committees that we set up: Public Health Committee, Economic Recovery, Arts, Culture, and Recreation, Education, Data, Communications, Faith-Based Organizations, and Community Outreach and Engagement. A color coding system was used to indicate risk level for activities and the reopening of businesses and institutions. Recommendations for Phase 1 are presented here. Phase 2 and 3 and final reopening recommendations to follow in the coming weeks. Phase 1 begins June 1st. The number of days per phase is based upon data received from the CDC document, Opening Up America. Dates for phases subject to change based upon local data. What we have done is put a 14-day period between each phase. So if June 1st begins some of the things that we're doing, you'll see some more stuff will begin possibly June 14th, June 15th. All faith-based services will occur virtually or via teleconference during this Phase 1. Recreation centers, parks, and playgrounds will remain closed. Block parties and special events will remain on hold. Information centers will be established in each ward, and 311 will be expanded to include a dedicated COVID-19 information hotline. A technology task force will be created to develop a sustainable citywide strategy for universal access to Wi-Fi and the hardware necessary for remote learning. An isolation and quarantine plan will be developed for those who cannot create one themselves. Guidance will be provided around emotional hurdles and fears related to medical mistrust. Letters will be sent to all businesses requesting plans to ensure the safety of their employees and the general public. City licensing, approvals, and permitting processes will be adjusted to streamline what can be expedited and waived. So let's get on to the risk levels. Newark reopening and recovery risk levels here. Red is a high risk area. Yellow, moderate risk area. Green is a low risk area. Notice we don't have one that says no risk, because as long as there's no vaccine or cure, you are still at risk. High risk means that face coverings are mandatory and the use of gloves is strongly recommended. Sneeze or cough into a tissue or the inside of your elbow. Avoid touching your face. Individuals with serious underlying health conditions, including high blood pressure, diabetes, obesity, asthma, low immune system, should not be present. Wash your hands with soap or water or use hand sanitizer, especially after touching frequently used items or surfaces. Yellow. Mandatory use of face coverings and the use of gloves are strongly recommended. Sneeze and cough into a tissue. As before, people should maximize physical distance from others and minimize spending time in crowded environments. Avoid touching your face. Wash your hands with soap and water or use hand sanitizer and frequently used items or surfaces. Green, low risk. Face coverings are strongly recommended. Sneeze or cough into a tissue. Once again, avoid touching your face or close contact with others. Again, wash your hands with water and soap. Use the sanitizer, especially after touching frequently used items. And blue is Newark reopening and recovering our new normal, which still requires face coverings. We recommend face coverings. Sneezing and coughing is still the same. Avoid touching your face, close contact with others. Washing your hands frequently, soap and water or hand sanitizer as well. I want to list the names of the folks on our committee, and then I'm going to allow the Chief of Staff to say a few words, and then Aisha Glover, and then Director Scott, and then I'll open the floor for questions in that order. So, Economic Recovery Committee, the chair of it was Latha Reddy from Prudential. Aisha Glover sits on it. Alicia Glenn, former Deputy Mayor of New York City, EHD. Burnell Hall, Invest Newark. Jeff Herbert, HRNA. Todd Rufo, Bloomberg. Chris Bernardo, Mount Prospect Business Improvement District. Adina Bayo Development. Jack Pine, L&M. Angelo Genova and Burns. Victor Helinsky, Sills and Cummins. Wasim Barai. And Education, chair is Dr. Lawrence Wells, president of Creed Strategies. Nancy Cantor, Rutgers. Roger Leone, MPS. Joel Bloom, NJIT. Dr. Monroe, Essex County College. Arts, Culture, and Recreation, Linda Harrison from the Newark Museum is the chair. Tanisha Nash Laird from Symphony Hall. John Schreiber, NJ Pack. Jeremy Johnson, Newark Arts. Rebecca Jampool, Project for Empty Space. Jake Reynolds, president of the Devils and Prudential Center. Community Outreach and Engagement, the Mildred Crump, Municipal Council Chair, and Ronald Chow-Yusan, Executive Director, they co-chaired that committee. Neil Greenstein from ShopRite. Sam Gonzalez, Councilman Ramos' office. Victor Cirillo, Newark Housing Authority. Damon Durden, Newark Community Street Team. Lakeisha Yuri, Office of Violence Prevention. Andrea Mason, People's Assembly. Victoria Hernandez, Executive Director. Kashim Holland, Financial Boss. Crystal Allen, Eyes Like Mine. Dr. Mamie Bridgeforth. Bernice Robinson, Assistant Central Ward Chair. Ronice Bruce, Bergen Lions Clinton Business Improvement District. Councilman Louis Katana. Marquise Lewis. Reverend Fowle, Louis Layton, and Reverend Mayoka Wyrick. In terms of data, Phil Scott, who is the chair, sitting here. Richard Marling, Rutgers Global Health Institute. Contact Tracing Task Force. Micheline Davis, RWJ Barnabas, and Perry Hycotis, School of Public Health, Rutgers. Testing Task Force, the Contact Tracing Task Force, Isolation Task Force, Dr. Sharif Elnahal, Maya Lordo, Essex County Health Officer, Christine Kraus, Dan Glenwell, Steve Hernandez, Marion Cardis, Dr. Joya Mukherjee, Jordan Thomas. In communications, we had Kay Wright from Audible, Caitlin Sullivan from Prudential, Mercedes Samuels, NJ Pack, Jim McQueenie, Winning Strategies, Christine Gilfillan, MCG Amelia Foundation, John Schreiber, Taylor Bonacorsi, Medina Creative Strategies, Regan Marsh, Dan Gwinnell, and Tamisha Howlman. And all of the pastors and reverends, we'd like to thank Dr. Ralph Branch, Father Timothy Grath, Pastor John Gamble, Imam Daoud Haq, Pastor Paul Valerius, Reverend Dr. Roberto Comisanes, Reverend Pamela Jones, Reverend Timothy Jones, Reverend Michael Gunleyi, and Rabbi Simon Rosenbach. So those are the people in our committee. We want to thank them for their service, continued service, in getting us to this point. Chief of Staff.
First off, I just want to thank our mayor for being a great leader during this time and allowing me to be a part of this committee, for chairing the committee, along with Aisha Glover. This has been a long task, and it's not over. Obviously, this is the first step, first phase into what we're doing, and there'll be more phases to come. But I just want to say one thing, and I'm going to let Aisha go deeper into exactly what we've been doing on the task force. This process is not coming out of our brain. It's not coming out of a vacuum. We have a lot of professionals, a lot of industry folks on the task force. The mayor made it very clear that he didn't want City Hall folks to actually direct it. So we got the ideas from professionals, from Prudential, from a lot of our thought partners around the city to be a part of this. So it's not just a city-oriented organization. So it took a lot of time, a lot of thought, a lot of energy, a lot of phone calls to put this stuff together. And again, I just want to say this is just the beginning for the reopening of the city. Aisha.
Thank you, and good afternoon, everyone. I guess I would just highlight the 7 things that the mayor covered. So there is progress obviously being made. Each task force has, each committee, has produced a pretty comprehensive set of recommendations. We expect a more thorough report. For now, we wanted to think about what we can zero in on and begin to start implementing in the first phase. So the mayor has been pushing us and has made the timeline pretty aggressive, and rightfully so. So that way we go in having an understanding of what the city is going to look like in the weeks and the months ahead. And most importantly, how we're communicating that to the residents and to the workforce here. So there's a range of recommendations that he highlighted across each of the committee's work. But behind each of those bullets is really an entire report and set of recommendations. Thank you.
Phil.
Good afternoon. I'd just like to thank the mayor for selecting me to chair this committee. This has been a great opportunity for us to really get an understanding of how this virus is affecting our community. We have been very closely tracking the amount of positive cases and the amount of deaths that has been impacting the city. Through his leadership, we have shown that the stay-at-home orders is actually effective. It's working significantly. A lot of our data shows that at the beginning portion, when we first found out about this virus, our cases spiked immediately. As we continue to do more testing and having people shelter in place, we see that the numbers have decreased dramatically. Not only have the number of cases decreased, the amount of testing has gone up significantly. We've increased our testing approximately 100% from where we were when we initially had our highest numbers. So even with the numbers of positive cases going down, our testing is going up. So our percent positives has made a significant decrease, and the leadership of the mayor really putting a lot of focus on staying at home and social distancing is absolutely working. So we want to continue to follow his leadership and working with this new 3-phase plan. Thank you.
I'll answer any questions now that people may have.
Mayor, the in talking about the blue new normal,
Right.
you're basically asking both residents and visitors to this city to wear a mask in public, in the NJ Pack, at City Hall, at work, whether it's Prudential or a boutique down at Market and Broad.
Right. It's strongly recommended in the new normal. There are phases where we say it's still mandatory. In the new normal, it's strongly recommended. And I think that that's necessary until there's a vaccine or a cure. And what people have to understand is when we open it up, it does not mean no one will get sick. People are going to get sick. The idea is that we're able to manage it. The CDC recommends that, the new number of new cases should be at least at 10% or so, right? To say that you can actually manage this in a way that does not create more harm. That's what the CDC is suggesting. Most states in the union are nowhere near that. By the grace of God, we're close. The state of New Jersey is a lot closer to that than most. When you get the less number of cases, you get less people going to the hospital. When people get sick, they can actually go to the hospital and not go home and die in their living room. There's opportunities for us to manage this in such a way where we don't have high deaths and the spread is not happening so rapid that we can't control it. So we still want to put measures in place to keep the infection rate low. Yes.
I have a two-part question. The first one has to do with development. Since March, there hasn't been a planning or zoning board meeting, correct? I mean, are you concerned about the slow of development in Newark and how that would impact the city's finances? That's the first.
Actually, these developers are still working. By the way, you can't stop them. The planning board, we're getting ready to have virtual planning and zoning board meetings coming up soon. So those things are getting ready to happen. And it was necessary for us to do it. It was necessary for us to shut it down. My number one priority is the health and safety of the residents of the city. The other stuff is secondary. And, now that we're at a place where we can at least think about these things, we're beginning to ease our restrictions a little bit, particularly around zoning board meetings, planning board meetings, and all of those things that are getting ready to happen virtually.
And also, too, last time there was a press conference here, you spoke about furloughs for city employees. I mean, where is the city at with that right now?
We already submitted it to the state, so we're waiting for whatever they're going to deal with when it comes back. When it comes back from civil service, we have to make a determination based on what's going on in terms of Sweeney's bill, and if that doesn't get signed, we have to go forward in another way. Yes.
You didn't seem too thrilled recently with some of the moves being taken by the state, particularly reopening retail. Can you talk a little bit about where you stand with the state as far as communication with what's coming down from the governor's office versus what you would like to see here in Newark?
Yeah, well, I'm on the recovery, one of the subcommittees on the recovery task force, and I make my my opinions very vocal. Newark is, and people are concerned in my mind about things that are not from the perspective of us here in the city of Newark. They're concerned about development. They're concerned about opening up stores. They're concerned about pools. They're concerned about tennis courts. They're concerned about all of these things, but they don't seem to be concerned about the fact that African Americans and Latinos are actually dying. And when I say they, I mean many people, right? And I know he's getting pressure from folks all over the state of New Jersey who wants him to move in a way that it is beneficial to their community. And he has to govern everyone. We are putting the pressure on our side to make sure that we do this methodically, cautiously, in a way that we can manage it locally, because we don't want to see spikes, right? We don't want to see spikes, and we want to, when we get through this, we want to take as many people with us as possible over the line. We don't want to leave people behind, and so that's what I've been concerned about. I've been concerned about the curbside stuff in the city. It has not worked the way in Newark as I predicted. that is working in other places. We shut down most of those stores yesterday and gave them an application to fill out, and told them they had to fill out an application and come up with a plan of how they're going to, in fact, do the curbside, because they had people trying on sneakers on the sidewalk, as I imagined. People trying on pants on the sidewalk. People getting their nails done on the sidewalk. I mean, this is the most bizarre thing you can imagine. But when people don't have any real direction on how to get these things accomplished, they take matters into their own hands. And if you don't let the municipalities actually govern, then you get these things. So we shut them down, and we gave them applications to fill out, and told them that they have to have a way for people to order, and then they come down and pick it up. If you don't have a way for people to order, then you can't do curbside.
What things are you ready, or do you think Newark is prepared to reopen in your vision?
Well, the Reopening and Recovery Committee has some steps, and we talk about everything from professional services to restaurants so there's a myriad of different things that we can open. It's just how we open it up becomes the question. How is it opened up? What are the safety measures there? And if you can't provide safety, then you can't open up. If you can't ensure safety, that's why we're asking all these businesses to have a safety plan. And if the safety plan is not adequate, then you can't open up, right? And then there's specific things that we have to do. Some of the ideas is, waiving the sidewalk kind of permits to allow people to have more dining outside, dining in a parking lot, show social distancing in these places. If you can't do that, you would be restricted to do something else. We're also putting signs in people's windows to let people know in the community that you still can catch the virus here. And I think this idea that everybody's roaming around that you can't catch the virus has to be pushed back again. So if you open up a restaurant, you still have to have a yellow sign in your window saying there's a moderate risk that you can catch the virus if you come in here. And we're going to require them to do that if they decide they want to open up. Yes.
Mr. Mayor, you had mentioned that the people of Newark, a priority for them is not development, is not, tennis courts opening. What are the important things for the people of Newark to see open, in your estimation?
Well, I said that because the important thing for us is our lives. That's the most important thing, particularly since we are dying at a higher rate than everybody else. I mean, out of every 100 people, about 7 of us are succumbing to the virus here in the city of Newark, which is higher than the state itself and probably higher than any other municipality in this state. We have to be cautious and careful about those things. And obviously, there are, based on the reopening committee, there are things that we're going to allow people to do. We're going to ease restrictions based on a time period and based on, what we think these industries can do to protect the residents and protect their employees. Yes, I got you back there. Yeah.
3 questions. On that note, where do you stand on residents visiting the beaches this summer?
Well, I got a Facebook Live every day, and if you heard me go off on a Facebook Live, I told my residents, don't go down there. I don't think they should go down there. I don't. I've told them, don't go. Don't come back here with something you didn't leave with. And I don't encourage it. I don't encourage it. If they want to do that, they have to make a decision for their family. And that's basically why we want to give as much information as we can, because people have to make decisions. And I honestly believe our residents, given the right information, will make right decisions for their families. And we're going to give them the information. I don't think it's safe. And I think it's a bad idea for people to go to the beach on Memorial Day. Yes.
Mayor, what do you envision opening on June 1st in Newark?
Well, June 1st I don't think anything is going to open June 1st. June 1st is phase 1. What we're basically doing is preparing people to get ready to open up, right? So they're going to see signs all over the city in parks and buildings and different things that show them what's safe to go in and what's not safe to go in, right? Businesses are going to start getting applications to fill out so they could do their permitting process, so they could say, this is my plan, right? These are the things that we're going to do. We're going to ease restrictions. You know, we're not going to rush down on everybody who's not outside, who's not in the house. You know, you can be outside with your mask on, but at the end of the day, we're preparing people for what we're calling phase 2 for us, which is when people will start being able to go into places that they weren't able to go into before, which in our mind begins on the 14th or 15th. Go ahead, one more.
So you don't envision businesses necessarily being open?
No, not June 1st. Absolutely not. Not June 1st. In some municipalities, they're opening up tennis courts. They're opening up. They might have opened up pools. All these other kind of things. I just don't agree with that.
Mayor, why are you not opening parks as part of phase 1? The state has put their parks open. The county has their parks open. Why not open parks in Newark?
The county parks are open in Newark. Weekway.
Parks are open?
Yeah.
I saw it on your slide that they're.
Weekway Park is open. Blanchbrook Park is open in Newark. People go there. As a matter of fact, they did a straw test in Newark because 90% of us had on masks and PPE in our park. So shout out to the Newark residents who went to the park with their mask on. But those parks open. City parks are not open. They're more difficult to manage. They're smaller. They don't have the capacity to hold as many people as a Weekway Park or a Branchbrook Park and allow people to social distance properly. Yes.
What is your best case scenario that you envision for a summer in Newark, this summer in Newark?
Wow. So we're going to do a lot of, so we're still doing summer youth employment. Most of it will be virtual. We are trying to organize structured events for youth, either in the park or in their complex, because a lot of our children live in these housing complexes, in a socially distanced way that the city structures and organizes for them, so we can be sure that that actually happens. Even having the fire department in some places using the hydrants as opposed to the pools. So we're going to be very creative about how we take care of our young people throughout the summer. And we do have events planned for them throughout the summer, but it won't be the same as they normally are used to.
Mayor, you're suggesting 14 days minimum before phases, and you expressed a hope that June 14th, 15th, you'll be able to go to phase 2.
That's right.
On the current trajectory. On that current trajectory, when do you, if we maintain the current trajectory, when do you think we could go to blue?
Wow. I don't want to speculate on that, but everything is 2 weeks. So if we continue doing well, every 2 weeks, you'll see something else happen, and we'll, obviously automatically get there, right? Through science and through our opportunity to see things get better. The 2 weeks in between that, so if you have a spike, we call this advancing. The 2 weeks gives us an opportunity to retreat. So June 1st gives us an opportunity to prepare. All of the stuff that people are doing, we just arbitrarily say, oh, we're going to open up this building now. Let's just do it. I think is ill-advised because the cities are not prepared to execute those things, right? You can't make a decision to tell people to do things that, one, they're not used to doing. They've never done this before. You tell me, oh, you can go curbside. Most people don't even know what that means. That's why they trying on sneakers on the sidewalk. And then the city has not organized it in such a way that it makes sense, right? So it's a free-for-all. And so that's why it's important for us to make sure we put businesses and folks on notice and begin to give them the things that we need so they can move strategically and methodically into the phases that we want them to move into, right? Absolutely.
Is there a circumstance where if the governor says, restaurants can reopen and you don't feel that Newark is ready for that, would you stop that? Or is there a chance too that you would go back a phase in a
Well, we're going to have a conversation with the governor's office, obviously. I mean, I'm not trying to have a rumble in the street with the governor, but, we're going to have a discussion with them about what we think is right for us. And I've had those discussions because our prescription is not the same. We can go to the same doctor and we get it for the same ailment and we might get a different prescription, right? We can't use, they tell you don't use other people's prescriptions, right? You got to use your own. And Newark has a different prescription than everybody else.
Have you received any PPP data from the state yet in regard to the, like, how many businesses have?
We have not received any data from them at all. Nope.
You don't know how many businesses at all have received loans?
No, not in an official kind of way. No. I got you.
Mr. Mayor, so between now and June 1st, businesses in Newark that want to reopen have to basically apply to the city, tell the city how they're going to manage this reopening, and then the city will judge that and determine whether this business can reopen, whether it's red, yellow, green, or whatever.
Absolutely. We're making a decision about whether you're ready to reopen and whether we're ready to reopen, right? So we have to be ready and you have to be ready. So we have to be some compatibility there. When we're ready, we want to make sure you have the ability to get yourself prepared now, because we assume that by the 14th and the 15th, if the trajectory continues to go the way it's going, we'll be able to say some things get to be open. And so you have to prepare your business to accept that. Now, if your business is not ready, then it's not going to be allowed to open. I don't care what anybody say. If your business is not ready, you can't open. Not in Newark.
And what will the city use to determine whether business is ready to open?
Well, they will give us a plan, and our committees will look at the plan and look at whether we believe that they can keep their employees safe and keep the patrons safe as they come into the. If the plan does not delineate that in a clear kind of way, then no, right? And even if they do that, and we think is a go, and we say this is great, we're still going to make them put a sign in the window, because we want our residents and our families to make informed decisions. We don't want anybody going to place and say, well, the city said this was safe, and I'm going in here to eat. We want you to put a sign in the window, just like you go to the hotel, and it says, lifeguards are not on duty, swim at your own risk, right? We want a sign in the window that says there is a moderate chance that you can catch the virus if you go into this place. And these are the things that you should be doing. If you're not doing this, the possibility grows. If you are, it's still moderate. Go ahead.
Ms. Glover, please. You said that this is the mayor has set a pretty aggressive timeline. What do you mean by that? Give me an example of what you're talking about, please.
Well, I'm going to talk about him as if he's not sitting right next to us. For the initial announcement of the strike force to when that date occurred to today, the fact that we're already before you and sharing some of the early recommendations, that was his desire to make sure that he's communicating clearly to businesses, to the residents here, so that way they're aware of what's coming down the pike. They know what to expect. So we anticipated 4 weeks of being able to work on a plan. We still will have a far more comprehensive plan. He is, and rightfully so, eager to make sure, because things are opening up around us, eager to make sure that folks understand that this will be phased, and there will be a process for businesses to go through as well. So it's not a light switch on or off. Right. It's almost like a dimmer.
And I want to add that I did not write any of this report. I did not meet with people to write the report. I did not come up with the recommendations on the report. All of those people that are sitting there talking about this stuff are in agreement that our health is the primary concern, which is obvious to me based on the recommendations that we got, that I agree with, by the way, by the grace of God. You know? Yes, ma'am.
So the governor recently allowed non-essential shops
Right.
to reopen for curbside or delivery only, and from what you're saying you've seen in Newark, it has not been completely prepared for that. And
right.
So as they're talking about rolling out restaurants reopening and
right.
even, curbside, are you saying that you need to have a conversation with the governor to say, listen, the rest of the state or parts of the state might be prepared for that, but you need to give us the leeway to decide that we can tell our businesses, no, you can't.
Well, yeah, and we're going to give him our document. We're going to give our document to the state and allow them to mull it over and go back and forth with us about it. We want that to in fact happen. We think that what we're doing in Newark is good for many other states, many other cities in the state. So we're going to give that to them, yes. And we want a 2-week period to retreat, and we need to be able to organize how these things are actually going to in fact take place. If that doesn't happen, then it puts us in a bad situation.
So non-essential curbside is still allowed right now in Newark, though?
Yeah, it's the governor's executive order. We can't stop people. What we are doing is telling people if they're not prepared to do it, then they can't do it, because it's still a violation of the order. The order does not tell you that you can sell sneakers on the sidewalk. It does not tell you can do nails on the sidewalk. It does not tell you. That's not what the intention of it was, right? So we are organizing it in such a way, telling businesses, you have to tell us what you're going to do and how you're going to be able to execute it. If you can't execute this, some businesses don't have a place where people could call or get online, and we've been telling them you have to create that. It's the new normal. Get you a Facebook page, an Instagram page, a phone number, somewhere for people to order and look at products. You can't bring products to the door and let people, I want this one, they'll take that back. You can't do that. That's not that wasn't intended for it. And that's why it's necessary to have a broad view of these things when you're getting ready to implement them. How are these things going to work in communities like Newark, who do not have the same kind of resources that exist in other communities around us?
There seems to be a lack of clarity all around with a lot of this that's going down to the business owners, all the way up from the federal to the state. What would you like to see as far as messaging from the state level and clarity to municipalities so they can avoid this kind of confusion?
Well, I think that there needs to be a lot more specificity in these executive orders that tells us exactly what it is that we can do. And I think municipalities should have a little flexibility in how to execute these things. So it's not a violation of the executive order if we are trying to organize a way to get it executed so that it actually happens in the best way to protect the residents of the city. That's all we're asking for. That's all we need. We don't have a problem with curbside. We have a problem with the way curbside is being done, and the fact that we don't have input in how to make that happen for us is problematic. And I think you cannot make broad kind of proclamations about a state that is so wide apart. And Essex County is completely different, right? The wealth gap in Essex County is tremendously huge, right? The average house in Newark is about $200,000. The average house in Millburn, 8 miles away, is over $1 million worth. So, I mean, the construct, the infrastructure of the cities are completely different. The needs, the resources, the things that we need in order to function properly are different. You can't make a proclamation that's going to work for Millburn that's also going to work the same way in Newark. It's almost impossible, right? And so you need us to weigh in and set up some kind of scaffolding in order for these things to work and become the most effective, right?
Last question.
Mayor, could you explain the color zones, the red, yellow, and green and blue? Is that for the whole city? Is it for zip code or neighborhoods or certain businesses?
So it's for events, businesses, locations, like, certain parks, basketball court, tennis court, different things like that. People want, we're going to put them, they're going to be all over the city, everywhere.
So I could have a red basketball court here and a green basketball court on the other side of town?
No, I would imagine that all of the basketball courts are going to have a red thing on it. Yep, because that's an event, right? It's an event in a location. You should not be playing basketball, so you're going to have a red thing. And what we're finding out, because we have an education and informational task force that goes out, we're finding out that people really do not have any idea what is in fact happening. They're listening to like fringe websites. They have half of information. They're not sure They're not watching me. They don't even know how many people are dying in the city. When we get on the phone, people say it's 500 some people dead. Wow, is that real? They think we're making it up, right? They're not sure of the information. They're not watching the governor's updates. They're not watching my updates. They definitely ain't watching Dr. Fauci and CNN. So at the end of the day, a lot of people in our community are far removed from the information itself. So they're relying on what we are doing, our movements and our actions and what we're doing. And so we have to inform them that it's dangerous. We're just not trying to keep you in the house to keep you in the house. And then they see everybody opening up. They see these crazy people going to the capitals all over the country with guns and nonsense because they can't go to the barbershop or to the beach or drink a beer at a bar. So they down at the Capitol with a gun. Meanwhile, in our community, people are dying. You know, we're 15% of the population. Latinos, 20% of the population. We're almost half of all of the cases in the entire state of New Jersey, right? I mean, those people ain't marching at the Capitol. I tell them they're not marching at the Capitol with guns to get you a job, to deal with, inequality or showing up because you don't have access to health care and your grandmother is dying. They're marching because they want to go to the bar or go to the beach, right? Because they want a haircut. And I think it's absurd. And it almost irritates me to have conversations with people about these kinds of things, about pools and summer camp. I get it. I understand. We've been in the house for 2 months. I get it. I know that there's anxiety, and then we have a tendency to push all of those things in the press. But the reality is, there are people that are not making it. They're not making it. And unfortunately, those people look like me. Thank you.